Have you ever wondered how mental health medication works? How it navigates the complex labyrinth of the human mind to alleviate the symptoms of various mental health conditions? It's a fascinating journey, one that begins with understanding the different types of mental health medication available today. Mental health medications can be broadly categorized into four groups: antidepressants, antipsychotics, anxiolytics, and mood stabilizers. Each type serves a unique purpose and targets specific mental health conditions. Antidepressants, as the name implies, are primarily used to treat depression. They work by increasing the levels of certain chemicals in the brain, known as neurotransmitters, that help regulate mood. But they're not just for depression. Antidepressants can also be effective in treating a range of other conditions, including anxiety disorders and chronic pain. Next, we have antipsychotics. These are used to manage conditions such as schizophrenia and bipolar disorder. Antipsychotics help to balance the levels of dopamine, a neurotransmitter that plays a vital role in mood, motivation, and reward. Too much or too little dopamine can lead to symptoms like hallucinations or delusions. Anxiolytics, often referred to as anti-anxiety medications, are used to treat symptoms of anxiety, such as panic attacks or extreme fear and worry. They work by slowing down the central nervous system, promoting a sense of calm and relaxation. Lastly, mood stabilizers are used primarily to treat bipolar disorder, a condition characterized by extreme swings in mood, from manic highs to depressive lows. They work by reducing brain activity, helping to balance mood and prevent these extreme shifts. Now, it's important to remember that the decision to prescribe medication is based on individual circumstances. It's not a one-size-fits-all solution. Each person's mental health journey is unique, and medication may be just one part of a comprehensive treatment plan. This plan could also include psychotherapy, lifestyle changes, and other treatments. Regular reviews with healthcare providers are essential to ensure the effectiveness of the medication. It's a collaborative process where the individual and the healthcare provider work together to find the most effective treatment plan. In summary, mental health medications come in various types, each serving a unique purpose and targeting specific conditions. Antidepressants, antipsychotics, anxiolytics, and mood stabilizers all play a crucial role in managing and treating mental health conditions. These medications, prescribed based on individual circumstances, form part of a comprehensive treatment plan that may also include psychotherapy and lifestyle changes. Regular reviews with healthcare providers ensure the effectiveness of the medication, making the journey to better mental health a collaborative process. Remember, understanding mental health and its treatment is a step towards breaking the stigma associated with mental health conditions, because everyone deserves to feel well inside and out.